Check the scene for immediate danger. Make sure you're not putting yourself in harm's way by administering CPR to someone unconscious. Is there a fire? Is the person lying on a roadway? Do whatever is necessary to move yourself and the other person to safety. If there's anything that could endanger you or the victim, see whether there's something you can do to counteract it. Open a window, turn off the stove or put out the fire if possible. However, if there's nothing you can do to counteract the danger, move the victim. The best way to move the victim is by placing a blanket or coat underneath their back and dragging it. Assess the victim's consciousness. Gently tap on his or her shoulder and ask, "Are you okay?" in a loud, clear voice. If he or she responds agreement, yeah or such, CPR is not required. Instead, undertake basic first aid and take measures to prevent or treat shock, and assess whether you need to contact emergency services. Send for help. The more people available for this step, the better. However, it can be done alone. Send someone to call for emergency medical services. Give the dispatcher your location and notify him or her that you're going to perform CPR. If you're alone, get off the phone and start compressions after that. If you have someone else with you, have him or her stay on the line while you do CPR on the victim. Do not check for a pulse. Unless you're a trained medical professional, odds are you'll spend too much valuable time looking for a pulse when you should be doing compressions. Check for breathing and make sure that the airway is not blocked. If the mouth is closed, press with your thumb and forefinger on both cheeks at the end of the teeth and then look inside. Remove any visible obstacle that is in your reach, but never push your fingers inside too far. Put your ear close to the victim's nose and mouth and listen for slight breathing. If the victim is coughing or breathing normally, do not perform CPR.